Joining me now are Amy Parmentier, Coordinator of Social Worker Services, and Myriam Golden, School Social Worker at Bryant Alternative High School. Welcome.
Thank you.
Thank you. Hello.
We are here today to talk about an approach that I don't think many of our parents are aware of, but you two are very familiar with it, called systems of care. Amy, tell us a little bit about what systems of care is.
Sure. Well, we're so excited to be here today to talk about this because one of the things that I think is one of the most special aspects of the work that we do in Fairfax County Schools is that we truly support every child, and that there isn't any child that we aren't supporting and working together collaboratively, both with parents, families, as well as the resources that are available within our community supporting kids who are having challenges. And so systems of care is really an approach to say, how can we collaborate more effectively? How can we be sure to engage parents in talking through when they have concerns about their child, about how their child's performing in school, about mental health concerns that may be emerging, and then how can we really pull together both school-based supports and resources as well as supports within our community to make sure that we get that kid to the other side in terms of a really great outcome.
Now, Myriam, you use this approach at Bryant Alternative School. Tell us about the typical child that might need this kind of an approach.
The child may look like this. They are referred to my services in the school because they are presenting behavioral issues. So they may not be behaving well in the classroom, they may have emotional dysregulation, and as I talk to the child, we get to explore more what the needs may be, and that will trigger the process of reaching out for the family and then reaching out to agencies in the community that can support the best functioning of the child and the family. Many times what we see may be the behavior of the child in school, but really the behavior is kind of the symptom, but behind that symptom we have a whole set of needs that need to be addressed. And by collaborating with other agencies, we can meet the needs of the student in school and outside school.
For example, what other agencies would you work with?
I work closely with the Department of Family Services, with Family Preservation, with non-profit agencies like Alternative House. Alternative House has many programs, and they have been so supportive with Bryant because they provide a program for unaccompanied youth that are for students between the age of 18 and 21. They also have the teen shelter, and they also have a program for young mothers. And our program provides supports to teen mothers. So that's one agency that has been really crucial for our service providing.
Now, Amy, I think you had mentioned before when we were talking a little bit about this that this really aligns with FCPS's mission of addressing the whole child.
Absolutely.
And tell us a little bit about that.
Well, that we know that we want great instructional outcomes for kids, but we also know that learning can be affected by mental health challenges, by family needs, by other issues that sometimes come up. And so some of the supports that we offer, both again school-based as well as our collaborations with our county partners, allow a student to perform in school. It provides them that social emotional support so that they really can access the top-notch instruction that their teachers are providing them.
Share with us, if you would, some success stories that you've seen using this approach.
I have one of my all-time favorites. A student who was a wonderful student, really performing quite well academically, and unfortunately had a mental health situation arise, and so she was very much struggling. Her family was struggling, parents wanting her to feel better and do better both in school and at home. And so we were able to pull together a whole team of resources for this young lady. And ultimately, through the support of her parents, through mental health services outside of school, as well as the support she received in school, she was able to resume her normal pattern. And I still get emails from her today when she's on the honor roll, when she's had a success at school, and truly those are the situations that I think we all work together to achieve those outcomes.
Right.
And again, it's just such an honor to be a part of a system that will not let even one child fall behind.
That's terrific. If parents want to find out more information about this, every school has a social worker, correct?
Correct.
That they can contact and tap into that resource.
Absolutely.
Good.
All of our schools have school social workers, and I have to put in a supportive plug for our collaboration as well with our colleagues in school psychology, as well as our school counseling colleagues. So we're really very blessed to have great professionals in every school who can support kids and families when challenges or even just questions come up.
Right. That's terrific. Thank you so much for being here.
Thank you.
My pleasure.